BBC research has found hundreds of black, Asian and minority ethnic doctors working for the NHS still have not had coronavirus risk assessments, or that their risk reviews, if they have been done, haven't been acted upon to keep them safe at work. The British Medical Association, which represents doctors in the UK, is calling on the government to renew its commitment to protect ethnic minority doctors. In a moment, we'll be speaking to Dr. Chand Nagpal from the British Medical Association. First, our reporter Amara Sophia Elahi, who has been looking into this and joins us now. Amara, tell us first of all, remind us the background to this.
Well, Joanna, it's widely acknowledged that coronavirus has had a disproportionate impact on black, Asian and minority ethnic groups, and studies have shown that they're more likely to get the virus and become seriously unwell or die from it. And there are a variety of reasons why that might be. For example, certain health conditions that are more prevalent within particular communities that raise people's risks, certain occupations that increase people's exposure. Even according to a Public Health England report from last year, racism or social inequalities may heighten people's risks. Now, if we look at the figures for doctors who have died from coronavirus, the British Medical Association has recorded 44 deaths of doctors, but 90% of those were from ethnic minority backgrounds. And in response to this, NHS England, as well as the healthcare systems in Scotland, Wales and Northern Ireland, issued guidance last year recommending that hospitals and clinical commissioning groups carry out risk assessments, particularly for non-white staff. And these risk reviews were a way of trying to protect healthcare workers by looking at certain factors such as age, ethnicity, underlying health conditions, and calculating an individual's risk based on all of those. So if doctors were found to be at high risk, proper protections could be put into place for them. For example, higher grade personal protective equipment, or they could be redeployed off frontline duties.
And so what's the evidence then on how much these assessments are being carried out and what happens once they are carried out?
Well, in January, BBC News sent a questionnaire out to ethnic minority doctors via medical associations across the UK. And one of the issues that we asked about was risk assessments and their outcomes. Over 2,000 doctors volunteered to respond to our questions. Of those, 850 said that they either hadn't had a risk assessment or that their risk reviews hadn't been acted on to keep them safe in the workplace. We asked other questions within our research as well. We asked about the impact of working during the pandemic on doctors' physical and mental health. And unsurprisingly, over 1,200 told us that they had been physically affected, while over 1,600 said that they had been psychologically impacted. And the research also looked at discrimination and bullying in the workplace, because doctors had shared accounts with us during the pandemic, telling us that they felt they had been treated differently to white colleagues, and they felt that sometimes work was allocated in more risky areas where their exposure to the virus was greater, and that their concerns about this weren't listened to. So of those doctors who answered our question, over 700 told us that they felt discriminated against by colleagues and managers during the pandemic, and another 700 told us that they had felt bullied as well.
Put some of that to Dr. Chand Nagpal in a moment, but just before we go to him, has the Department of Health responded to any of this?
Well, NHS England have responded, and they tell us that 95% of staff, of ethnic minority staff, have had risk assessments, and that vulnerable staff have been protected. They add that every employer is required to support workers who raise discrimination issues. And this has been echoed by the healthcare systems in Scotland, Wales and Northern Ireland.
Thank you, Amara. Well, let's go to Dr. Chand Nagpal. So what's your response then? Because obviously the report indicates that the risk assessments are not satisfactory. The Department of Health saying they are being carried out.
Yeah, so these findings are distressing, but they actually mirror our own surveys from the British Medical Association, and they reflect a much wider problem than only focusing on the pandemic and risk assessments. You know, the first thing is that when you have a picture of nearly 9 in 10 doctors who have died all coming from an ethnic minority background, you can see why we do need to put in place protective measures to make sure that sectors of our medical profession and healthcare workers are not impacted upon unfairly. Now, risk assessments are not a tick box exercise. It's not just the case of having had an assessment. It's more a case of whether adjustments have been made. And that then relates to wider inequalities in experience for our ethnic minority doctors. The survey that from the BMA, including our own surveys, have shown historically that doctors from an ethnic minority background are more afraid to speak out. They're afraid that when they do challenge the authority in their hospital, for example, they're more likely to be blamed. They may have recrimination and suffer problems around career progression. That is what our surveys are telling us. So if we are to actually address this, we have to address the cultural factors within our health service that have resulted in ethnic minority doctors feeling unfairly treated. They have reported twice the level of bullying and harassment as their white counterparts. And that has become worse during the pandemic at a time when doctors do need to feel supported, not afraid and bullied and harassed. So there are wider implications from these findings that we do need to tackle if we are to have a health service where we can be fair to those working within it.
These are obviously difficult times, and the NHS has been under enormous pressure. With 40% of doctors in the UK from ethnic minorities, how can they realistically be redeployed in order to address concerns around exposure to, the vulnerability around COVID?
Right. So first of all, these risk assessments are designed to identify those doctors for whom the risk of exposure to COVID is high. So it's not that 40% of doctors would be redeployed. It would be a very small number. The second is that there is a lot of opportunity to work differently at the moment in the health service. Doctors can provide virtual consultations. Large numbers are being done that way. Working, or perhaps working in a less COVID-facing environment. But we're talking about small numbers that would need to be redeployed. Having said that, what's really important is that doctors feel comfortable and able to speak and express their concerns and to be able to feel that the employer that they're working with it has their back. Because that is the one thing that we all deserve.
And you mentioned the feeling amongst those who feel vulnerable. Tell us a bit more about that psychological pressure on people going into a workplace where they don't feel safe.
Yeah, so if an ethnic minority doctor going to work knows that he or she has a far risk of serious ill health from COVID. They know that 9 in 10 of their colleagues who have died have come from an ethnic minority background. That's a pretty horrific statistic. And then when they go to work, what they're saving the lives of others. They're doing their duty in serving the nation. What they expect is for the system, the NHS, to look after them, to make sure they're given the right protective equipment to prevent them becoming infected, to make sure they're working in an environment they feel is safe. And if they have specific additional risks like medical conditions, that those are taken into account. That requires a conversation where they feel listened to and where they feel able to speak out. What the surveys are showing us and what the BMA the BBC findings have shown is exactly what we found, that predating the pandemic, is that doctors from ethnic minority backgrounds feel afraid. They do feel afraid about speaking out, about challenging, about raising safety concerns, because what we know is that ethnic minority doctors are twice as likely to be complained about by their management, twice as likely to be referred for disciplinary processes, twice as likely to be bullied and harassed. So that picture puts ethnic minority doctors in a very difficult position. And so the solution has to be to address those root cultural negative experiences, and that requires systemic change.
Thank you very much for joining us, Dr. Chand Nagpal from the BMA and our reporter Amara Sophia Elahi.